Hi guys, it's Grace with Grace Gets Gastric, and I am here today for part five in my pre-op series. Today I am going to be talking about my endoscopy and sort of how I came to the decision to get the VSG versus a different kind of weight loss surgery. So a requirement for my program, not insurance, but by my bariatric program, was that anybody who's considering getting weight loss surgery, in particular anyone who's leaning towards VSG, my surgeon requires that they get an endoscopy. The reason for that is that it allows them to see the health, essentially, of your stomach. If you're looking into VSG, one of the more significant complications post-op for VSG is that there is a high incidence of severe acid reflux or GERD. So if you have any predisposition for acid reflux or GERD before surgery, my surgeon, depending on what your stomach looks like, will not perform the surgery. That was actually one of the questions I asked him, was about his complication rate for GERD post-op VSG, and he has a very low complication rate because he simply does not perform the surgery on patients with a severe risk factor. In those cases, he would recommend the RNY. So because the VSG was one of the ones I was leaning towards and my preference, they did want to make sure I got endoscopy. So I think I'm saying that right. Anyways, I had never had an endoscopy before, have had very limited any kind of medical procedures, so I wasn't really sure what to expect. I got there, my surgery was scheduled for 8:30. They told me to get there about 2 hours beforehand, so we got in, I got there around 6, and we honestly ended up sitting there for quite a while before we got in. Sorry, I'm reading my notes that I took beforehand, so I just kind of want to make sure I don't forget anything. It was at a hospital, so it wasn't actually at my center. My center is part of a larger hospital, so it was within that same hospital, but, you know, through a different area, ones that specialize in this. It was actually my surgeon, so the surgeon who performed my VSG is the one who did the endoscopy. This was actually the first time I met him. So I got the endoscopy in August, started this process in April, May. So I didn't actually really meet him until the day he was performing my endoscopy, which was just very briefly at that point because I was like about to be sedated. I was like on the table. So they took all of my, you know, blood pressure, all of that standard stuff. And then, God, the surgical rooms, you know, we were taken to the surgical room, which are always just freezing cold, by the way. So that's just something I really remember. And this is when I met my surgeon. He said hello, went over very quickly what was going to happen. I signed some forms, as you do. And then he put this like weird pillow block thing like behind, because I was kind of like propped on my side. And so he put this like pillow block thing behind me, I guess, so I wouldn't fall over. And then he put like the oxygen things in my nose and put some sedation stuff in my IV. And the last thing I remember is them putting like this thing in my mouth, kind of like the first thing I'm like is like a ring gag, which maybe I shouldn't know what that is. But you know, it's just like, there's no way for me to mime what it is without being real inappropriate. But basically it was like putting on like a gag that like had a hole in it, I think, so that they could stick. It was like basically to hold my mouth open. God, there's no non-inappropriate way to do this. So that they could stick the like camera thing, endoscopy thing, down my throat. So after that, that's the last thing I remember, and it all just goes a little bit fuzzy after that. I have very vague recollections of like some pain and like almost like the feeling of choking. And I'm not sure if that's 100% real or if it's sort of imagined. I'm thinking it's, you know, maybe I came in it at some point and then was immediately out. And it was just like an after impression. Nothing like terrifying or scary or anything like that. And I'm honestly not even 100% to the point where it's like, I'm not sure it was real memory. I think it was, but it almost feels like maybe I was making it up. And let's see, then the next thing I actually really remember is waking up in recovery with my sister's phone in my face, and she was really disappointed that the sedation hadn't made me loopy, because she was hoping to like film me being an idiot. So a lot of things they say with the endoscopy is that you kind of feel like a scratchy throat, sore throat afterwards. I didn't feel that too much, but I did feel kind of like a tenderness, like deep down in my throat, almost kind of like a bruise that I could feel when I like swallowed, but it wasn't super scratchy, super painful. It went away in like a day or two. And then, so that was on I don't know, like a Tuesday or Wednesday. And then Friday, I went back to my surgeon's office, and this is where we went over the results of the endoscopy, and like I more officially met my surgeon. We actually had a conversation, and that's where I really asked him the questions about complication rates, all those questions that you should be asking your surgeon, a surgeon that you're considering. If you Google like questions to ask your bariatric surgeon, questions to ask your surgeon, lots of things will come up. Okay, so there was some stuff, I think I've talked, like my center has some like issues with scheduling, but I also met with the dietitian for one of my regular checkups, and then I met with my surgeon. So I knew from the get-go, like I said, that the results of the endoscopy were going to play a large role in the surgery that I ultimately decided to get. From the get-go, I was leaning towards the VSG. Really, there would only ever really be three that I consider: the VSG, the RNY, or the DS. I ruled out the DS pretty quickly. I am fairly young, and the DS is fairly aggressive. So that is not something that I would rule out forever, but it is something that I would not want for me at this age to be my first step. So I ruled out the DS. So then that would leave the RNY or the VSG. I would have been fine getting either of them, but of the two, the VSG has marginally less complications, not by a significant amount, like they're pretty close, but low enough that, you know, but enough that I was considering that. And while the fact that the RNY has malabsorption has a lot of pluses to it, it seemed like an extra step that I would prefer to avoid if I could. You know, not only is it changing the size of your stomach, but it's also messing around with your intestines. Again, because I'm so young, I did have some concerns about the effect of malabsorption later on when, you know, I don't know what health conditions I'm going to develop later on in life. I don't think that it would have been, you know, like insurmountable if I had had the RNY and something else had developed. But if I could avoid having a potential issue with malabsorption, that was my preference. Particularly because I am aware that the necessity to revise might always be something that needs to that might be something I want in the future. If a complication arises due to my VSG, if, you know, I'm still young, 30 years from now, there is a reason why I need to revise. For me, it seems like it would be smarter to start with sort of the least invasive, I mean, they're all invasive, option to kind of leave some wiggle room. You know, I didn't want to start out right out the gate with something like the DS, and then like kind of have nowhere to go from there. So I was always leaning towards the VSG. My one concern was the high instance of GERD. I had very, very mild and very occasional instances of some heartburn pre-op. It was very inconsistent, very sporadic, very mild. But it did happen. And so that was always a concern of mine, that I wasn't 100% sure what was going on in here. And heartburn can be, I mean, like acid reflux and GERD can be like debilitating. Having it can lead to things like esophageal cancer. And being on something like a PPI or an acid blocker has other complications, can lead to osteoporosis and other issues. So I both did not want to live with GERD long-term and would not want to be on a PPI long-term. So all of that being said, I knew that if I had issues with my endoscopy, I'd be getting the RNY. And if not, my preference was to go to the VSG, but I was open to the RNY if my surgeon thought that was preferable. So, met with my surgeon, and my endoscopy came back clear. He actually said I had a pristine esophagus, which I didn't know you could feel proud of your esophagus, but I learned that day. And so, yeah, everything was totally fine. I didn't have a hernia. I don't have any issues. There was no concerns on his part in terms of what he was seeing in there. And when I mentioned that the VSG is what I would prefer, he 100% agreed. He said that is what he would recommend. If he had a daughter my age, he said that is what he would advise her to get, based on my medical history, my age, my risk factors, all of that. Keeping in mind, I do have diabetes. I did have diabetes at that point, and that was also a factor. DS the DS has the highest instance of diabetes reversal, then the RNY, then the VSG, but I also was fairly newly diagnosed with diabetes and had it very well maintained. So if I had it for longer, if I had been on insulin, I probably would have preferred to get the DS or the RNY, but because it was so fresh, if you will, I had every confidence that the VSG would do what it needed to do to reverse it, and it did. Let's see. And he agreed with me, because that was the other concern. That was one of the biggest reasons I got the surgery, was to reverse the diabetes. And he agreed, again, given all of my factors, that the VSG was the right choice for me. So, yeah, I had my endoscopy, and with the endoscopy, officially made my decision in August of my process that I would be getting the vertical sleeve gastrectomy. If I had to get the RNY, I think that would have been fine. While I preferred to get the VSG and that is what I got, I don't want to by any means scare people away from the RNY. I think it is the right choice, or a preferred choice, for a number of reasons, which in some cases, which I have mentioned earlier in this video. Same thing with the DS. I don't think either of those would have been bad choices, and if those had been the only options available to me, I still 100% would have done those. I think I would have been just as happy and successful, possibly even more successful in terms of faster weight loss, because both of those surgeries often do lead to a more rapid weight loss. But yeah, I think that's everything I want to talk about in this video. I just wanted to kind of go over kind of how I came to my decision, why I made my decision. I hope that's helpful to you. I did so much research, and that is, I'd say this a lot, one of my number one things is, if you're considering the surgery, look into it. Watch YouTube videos, research what the procedures entails, what the complication factors are, the risks, the rates of complication, and ask your doctor a ton of questions, because they're not always going to tell you. One thing I thought throughout my process was that my bariatric center seemed very competent and great, but they never really told me anything I didn't know. In talking with a coworker who recently had the surgery, she mentioned a number of things that came as a surprise to her, having just recently had the surgery. And I realized that because she hadn't done the extensive research that I had, the center hadn't necessarily adequately prepared her for what to expect, because they just don't cover everything. And you really got to be your own advocate for these kinds of procedures. You have to essentially make them tell you things and find out information for yourself. So I think this video is way longer than I intended, but what else is new? I hope you enjoyed. I hope you're enjoying the series. I believe I have one more video left, which is on my approval process and my 2-week pre-op diet. And then I think that's everything I've planned. But hope you guys are doing well, and I will talk to you all soon. Bye.